Welcome everyone to our session on teaching and helping skills with the wonderful author team of the 6th edition of Helping Skills coming soon. As you're joining, please share with us in the chat where you're joining from. We'll be starting in a few minutes. Again, welcome everyone. As everyone is filing in, please share where you're joining us from in the chat. As everyone gets settled and ready, we'll be starting in just a minute. Toledo, Salem, Texas, Minnesota. Welcome everyone. Philippines, India, Taiwan, Germany. Wow, quite the international audience today. Welcome everyone. Welcome, welcome. My name is Andrea Bergoa. I am the Higher Ed Course Adoption Marketing Manager here at APA Publishing. We are excited to welcome you today to our session on teaching in the helping professions with the author team of the upcoming 6th edition of Helping Skills. Before we get started, I just have a few housekeeping items that I want everyone to keep in mind. So all attendees are muted to prevent accidental noises and distraction, but there's multiple ways that you can communicate with us. So the reactions are turned on. Feel free to react. Of course, you're all using the chat, so please use the chat to communicate with fellow attendees. Make sure the to line says everyone instead of panelists and host. If you have questions for our panel, please use the Q&A. Chat tends to move very quickly, and so questions asked of us may be missed in the chat. So please use Q&A. And then this is being recorded, and it will be shared afterwards. That also includes a chat transcript and closed captioning. So that will be shared as soon as we can after the meeting, and everyone who attends today will also be receiving an attendance certificate in the next week. Please be patient with those. It is a manual process. It is not automated, so it does take us some time. Again, I just want to welcome everyone to our session on teaching helping skills. And I am going to turn it over to our wonderful panel. Thank you so much.
Thank you all, and it's delightful to be here today. I've spent all of my career working with helping skills and teaching helping skills, and it's just delightful to be able to talk to you today about focusing on teaching helping skills. The theoretical foundation for helping skills training came way back with Rogers in 1942, when he thought that paraphrases show clients you hear what they're saying, you're mirroring them. And his notion was that that was all you really needed to help clients come back to their organismic valuing process, to learning about who they are, and that they could have the agency then to make changes on their own. And initially, Rogers thought that those skills, like restatements, reflections of feelings, could be taught. And that spawned many, many helping skills training programs, including ours. At this point, we've had 5 editions of the Helping Skills book, and the 6th edition is scheduled to be out in December. Just a very quick overview of the Helping Skills model. It's an theoretical model, pan-theoretical model. What we found in research, of course, is that all the orientations work equally well. And so what we really need to do is take the best from all the different orientations and combine them in a way that makes sense. So we've combined client-centered, psychodynamic, and behavioral orientations into focusing on exploration, insight, and action. And I would note that the biggest change in the 6th edition is that we now consider these as goals rather than stages. The idea that it's sequential, that exploration always leads to insight, always leads to action, is very simplistic. And we're really coming up with this notion that the foundation for all of helping is exploration, that exploration goes on all the time, and that sometimes there's a need for insight and sometimes that there's a need for action. So we need to be much more aware of what's going on with the client and what they need at different times. I want to spend just a minute talking about the empirical foundation for the effectiveness of this model. We've done a fair amount of research at this point, even though research in this area is hard to do well. we've done several studies, and we found pretty good evidence that this model is effective and it's empirically supported. We found in several studies that trainees have increased self-efficacy for using the skills. They feel more confident. And I think that confidence is much of what we want to build with beginning trainees, because they so often feel so anxious that we need to help them learn to feel more comfortable. We've shown evidence that they increase in using their exploration and insight skills, and they reduce their amount of talk time, which means they have more time to listen, because much of the main thing that in friendships, we talk 50% of the time. As helpers, we talk maybe 20% of the time. So we really need to make a change from how we work with friends and family to how we work in a helping setting. We've also found evidence that trainees maintain skills after 5 years, particularly if they continue training. And we found good evidence that instruction, modeling, practice, and feedback are all effective components of training. But practice turns out to be the most effective. Trainees have told us many times, reading lectures, they're helpful, they're nice. Modeling, it's great to see other people do it. But the most important thing is practice. When you look at somebody else do it, it looks pretty easy. When you try to do it yourself, especially when you're working with a real clients talking about real problems, you really recognize how hard it is to use these things, to modify them to fit the individual person. So practice, and we'll come back to this as we're talking more. And finally, trainers account for about 7% of the variance in increases in trainee self-efficacy. And it seems to be best if trainers are authoritative, setting high expectations and providing clear and reasonable demands. There's a lot of research that's left to be done, but this is a preliminary notion to let you know that there's some effectiveness in this model. And now we're going to change the focus, and for the rest of the time, talk about tips for teaching based on our experiences around the years. And I'll let Harold take over next.
Actually, it's going to be me.
Judy, take over. Sorry.
No worries. Hi, everyone. It's great to be with you all today. So as Clara mentioned, we're going to take a deep dive into some tips that we've gleaned from designing and teaching this course over the years. So first and foremost, it's important to talk about how to even set up and structure the course and the classroom. This is quite a unique course, which stresses both theory and practice, as Clara mentioned, and it requires pretty active student involvement and participation. So from the beginning, it's important that instructors set a climate to help students understand that this is a different type of class than they may have experienced before. Part of that difference as well is that it's not a cookbook approach. In our experience, sometimes students come in and they're looking for the right answer or the right way to use the skills or to give an intervention. And it's really a paradigm shift to help students understand that there is no right way to do things. There are many different ways to do things, and it's about what works for that individual helper with that individual client in that particular moment. And that's why in this course, we teach students all of the basic skills so they have them in their toolbox and can try out different strategies as they go along. So in thinking about who is this course even for, what is a good audience for this course, this is a course for either undergraduate students or graduate students in many different fields. Really, it's applicable for anyone who's going into a helping profession. So that could be psychology, social work, medicine, teaching, nursing, chaplains, clergy, anyone going into helping profession. And we really stress that this course is going to help people in their interactions and relationships, both professionally and personally. First thing that you might think about when developing a course is how to put together a syllabus. And it's important to be as explicit and thorough in that syllabus as possible so that you can anticipate any problems and hopefully avoid things that may come up down the line. But we found it's helpful to give a very detailed syllabus. And if you're thinking about giving this course in a virtual setting, to be really clear about expectations of devices, multitasking, having videos on, all those sorts of things. In terms of the size of the course, we found it's ideal to have about 30 students in the course, and then to be able to break them up into 3 or 4 subgroups for labs. In thinking about the duration of the course, we found it's good practice to have about 75 minutes to 2 hours for a lecture with an accompanying lab, or to combine lecture and lab into a 2 or 3 hour time slot. For the room setup, it's helpful if you can have a spacious and flexible setup so that you can move chairs around when you are pairing students together, which we'll talk about in a little bit. But of course, you know, we don't always have the ideal situation, so whatever you have, you can roll with it and adapt and adjust as you go on. So I'm going to pass it over to Harold for the next tip.
Sure. Hello, everyone. So I'm going to talk about the role of the instructor. So as Judy mentioned, this is a very different kind of course compared to a theory course or something that's really content driven. But because of this is a helping skills course, it means that there may be some expectation that the instructor in front of them is a professional helper. And this can come across in many different ways. So for example, in the course syllabus, you might have indicated your credentials. So you may be a licensed psychologist or a counselor or a social worker. You may have done that in your introduction as well. So you may have talked about some of your work outside of teaching helping skills. So you could be a clinician or doing other kinds of helping professions. So with that said, there may be a lot of expectation that because you are a professional helper that you may be able to help the students too. So, but we want to emphasize that it is important to set the boundaries early on in the semester before students start disclosing their problems to you or disclosing during the role plays during practice sessions. Just to let them know, because it may be something that students are not thinking about in terms of boundaries, but it's important to emphasize that your role with them is still an instructor. You are still responsible for their grades, and you are still responsible to, let's say, if they are not so engaged in the practice, you may have, to remind them or alert them. So just to set the boundaries early on in the semester is important, but at the same time, try to do it in a human way. So just be human, because in a lot of the classes that I've taught, students are at different levels of openness in terms of talking about their own problems. So as Judy mentioned, that there will be practice sessions where students play the role of clients, and that in itself involves some kind of disclosure. So in doing that, we emphasize trying to be human as instructor in a way that allows students to know that, this is okay, a safe place to disclose some things. For example, for myself, I may speak honestly about my process of learning and helping skills, what it was like to be learning the skills on early on, and being very nervous and really not knowing what to say to a client sitting right in front of me. And so this is modeling disclosure as well as trying to model genuineness, right? So as Clara mentioned, we are trying to do what Rogers is doing in terms of reflecting and restating. So we want to do it as genuinely as possible. So the second point I have here is to encourage an environment of critical thinking and allowing students to challenge you and their classmates respectfully. So this is really a course about human relationships and about the experience of helping people or having received help, right? So students have a lot of ideas to share. And because this is such a common experience, getting help or helping others. So we encourage all the students to be able to voice different opinions. For example, if we show a video and ask for students' reactions, they may have, preferences to what the helpers is doing, or they may not like the helper. So we just try to encourage students to be able to voice their different opinions, just to create an atmosphere that is accepting. For example, trying to also model the acceptance as we try to teach the students that they should try to display acceptance towards the clients. Okay, so being able to hear multiple perspectives will help the students to be less judgmental when listening to the client's problems. So the last point here I want to emphasize is that we can learn a lot from the students, because each time I teach, it is a reminder for myself that it is not so easy to be doing this for the first time. Sometimes it's so difficult to remember after having done this for so many years. But in the students' place, they have a lot of difficulties, and we sometimes forget. Secondly, is that it's just like clinical work, our students are also very different. Each student has a different personality, and they respond to instructors' feedback very differently, or respond to a question or discussion very differently. So each time being really alert and also responsive to our students is actually very enriching for our own teaching experience. So yeah, that's the role of the instructor.
So next we're going to talk about ethics and our disclosure policy. So first of all, students should understand that after taking this course, they are not licensed clinicians, they are not professionals in any way. The goal of this course is that by the end, they should be competent in being able to use the basic helping skills. So, of course, confidentiality is a bedrock of our profession, and it's important to start getting students comfortable with understanding how to discuss confidentiality and limits of confidentiality with their clients, as well as for the students themselves in the course to understand what it means to keep everything that is said within the course confidential, so that they're not sharing, what their peers brought up in the helping sessions or in any practice exercises with people outside of the course without the express permission of the other students. In terms of thinking, how to teach students about confidentiality, we've tried a few different things in terms of actually kind of walking through the limits, and just to keep in mind there are different limits based on the location and the laws that apply to your particular location, but to be teaching them what those are and how to discuss those with clients. We've also sometimes implemented a special activity during a lab to get students to really feel what is it like to be in the role of a client and to be trying to be vulnerable and to share some really deep and personal information with someone else who at first may be a stranger to them. And so we have students write down their deepest, darkest secret and actually give it over to the instructor without the instructor looking at it, but just to feel what it's like for the instructor to be holding that information, and then to process together what it would be like if the instructor were to share that with someone else. In terms of disclosures, speaking of disclosures, we have two options for disclosures. So students can choose to disclose real information about themselves, which we recommend to disclose relatively minor issues or problems. For example, maybe discussing their career decisions or graduate school applications, time management, roommate problems, basic relationship issues that may be coming up. We ask students to not be sharing very intimate or personal intense problems. Like, it would not be appropriate for a student in this class to be disclosing sexual trauma or suicidal thoughts, for example. We actually have a table with topics of disclosure suggestions in the textbook for your use and for your students' use. The other option is that students can assume the role of a client. So they can sort of adopt a persona in which they're not disclosing their own personal information, but they're acting as another person. And we just ask the students to not reveal whether they're, being themselves, sharing real information, or adopting this persona. We do encourage them. It is preferable if they show up as themselves and, be real, but it's important that students understand they do have a choice in that. And we remind students that in no way is this course a substitute for therapy in any way. but at times students may be disclosing some information that seems questionable or seems like they may need additional help, in which case, as instructors, it's important that we empower our students to seek help and maybe even, give referrals to our students. And finally, when it comes to ethics, it's also important to stress to students that academic honesty is of the utmost importance and really critical for us to be thinking about as instructors, to be thinking about this, especially with the rise in AI. So I'll pass it over to Clara. Or sorry, to Harold.
Yeah, so I will talk about lecture.
Sorry, there you go.
Okay, so lecture. So really it's important to not just repeat the text, even though the text is really good. I mean, the three of us wrote it. So there are a lot of examples. There are many good vignettes about how clients and the helper go back and forth. There are good explanations, but it is still not enough. We try to make the lectures as lively as possible, especially this is such a human subject, right? So we try to incorporate clinical examples or practical examples, because this will really make the discussion and the students to pay attention. I think the students really lit up when they hear stories that from real life. But we also want to emphasize during the class that we are also ethical helpers. So we will protect confidentiality by changing details of the client's information, their jobs, their location, or their presenting problems, or we can say that we mix up different client scenarios and to present them that way. Okay, so, and then the third point here is really begin introducing conceptualization and responsiveness as the students become more comfortable with the basic skills. So once they have learned the basic skills of asking open questions and restating or reflecting feelings, it is important to help students to integrate what they learn about theories, about people or personality as well. So, for example, we can encourage students to ask an open question, but what kind of open questions? What's the content of the open question? And it's really driven by the conceptualization that students have about their clients, what is important to ask at this moment, and also be responsive to the client's response, right? So, for example, if you challenge the client and the client went quiet, how do you follow up? How do you make sure that your interventions are not offending to the client? Are you being observant of their nonverbal behaviors or even verbal behaviors that may have hidden messages? So these things are something that is difficult to teach at the basic level, but it is something that we learn over the years of teaching. This is really part of helping skills. Really, to do helping skills well, it's important to think about conceptualization as well as responsiveness to the client. And the last point here is to use lots of different teaching methods to cater to the different learning styles and cultures. So the lecture and discussion here, I give several examples of discussion. It really depends on the class size. So for example, if you have a class size of 100 students, it's really hard to have discussion. People raise their hand, and if you have too many hands being raised, then you have a difficult classroom to manage. So you may want to bring it down to a pair discussion or a small group discussion. Or if you have a classroom of students who are very quiet or very shy or at the beginning of the semester, I would encourage to do more small groups or pair discussions so that more students can be involved rather than the very vocal few of them who will keep talking or keep contributing to the classroom, right? So it really depends on your class. And again, as instructors, we try to be responsive to the class, the students, as well as the group climate. And then the second point here, I talk about technology. Sometimes I use polls. So for example, there's a website called Slido, Slido, and you can do anonymous polls. And for example, things like I will ask the students, how many of you have been in therapy before? Or how long have you been in therapy before? And people can use their phones to answer anonymously. And then this gives the students a chance to see the spread, the distribution within the classroom, especially if there are questions or answers that may be too sensitive to raise their hand, but it is good for people to know that they are not the only ones also, right, in the classroom setting. And then word cloud, for example, in the teaching of the reflection of feelings, I ask students, what are you feeling right now? Write 3 words of your feelings. And then, you can see this, what feeling words they have come up with. And you can use a word cloud because it will tell you the proportion of the people. So if the word is big, very frequently reported, it will appear very big on the cloud. And usually when we do this exercise, the most common word that I see is tired. I don't know why students are always tired. And that's the most frequent feeling word. And it's kind of fun. So it is another way of making the class a little more engaging. And finally, we have a lot of videos of helping sessions. So for example, in the helping skills textbook, they are also accompanied with different videos, and we have helping interactions, and students can have an experience of talking about their reactions to the helper as well as to the clients. And you can do it in a whole class format or small group format so that more students can engage. And also perhaps you can give some prompts before you show the video so that they are more focused as to knowing what they're looking for or what you're asking them to look for in the video viewing session. Okay.
Great. So since the core of this class is about practice, we found that it's very important for students to actually be doing practice sessions with clients or helpees, as we say, other students in the class. So not just, responding to vignettes or having, short 2 to 5 minute interactions, but having a more extended interaction where they can really utilize different types of skills, feel what it's like to be in the room with the client. And so in our labs for this course, we typically have students do at least 2 practice sessions throughout the semester, sometimes even 3 or 4, so that they can see their progress and track their progress over the course of time as they're learning the skills. For that initial session, it's helpful if students have had some practice even from the beginning of the course. So right from the start, to throw them into the practice, get them to try out different types of skills, and to really prepare them well for that initial session. We should work under the assumption that students have not had a course like this before, have not done a session like this before. So students often really don't have a sense of what will this look like, and often approach that first session with a lot of anxiety. So it's helpful to, of course, first normalize that anxiety and also to provide some structure and scaffolding so that students can make the best use of that time. I can say for myself, we have a packet of information about that initial session. And I think in my first few courses, I would, just sort of assign that packet as reading and then have them show up and do the sessions, and then learning very quickly, oh, that's not enough. And so spending some time in the session before that initial session to really go through that packet and to explain and answer any questions that may come up. So it's important for students to know, how will they get started? How will they be paired up with other students? Are they meeting in a different space? Is it a different time? How will they record the sessions so that they can later write up a transcript of the session and code for skills, intentions, and alternative interventions? And how will they split up the roles, which Clara will talk about a little bit more in a moment. Also, it's critical to provide feedback to our students as instructors. So when they complete that transcript, for us as instructors to be going through and looking at their responses, seeing how they're doing with different types of interventions. Maybe they're speaking quite at length. If you see a transcript and you see a whole page of the helper speaking, making a comment like that, providing alternative interventions that you might use as a helper. All of those sorts of things are really, really critical for our students. It's also helpful to set a climate for students to truly act like professionals and to take this practice seriously. We've gotten feedback from students, and we've seen in our own courses the difference it makes when students are just, seeing this as another kind of group assignment and doing it more chatting, versus really trying to embody the role of a helper, of a therapist, being a professional in the room. When you think about how to pair students for these helping sessions, it's helpful if you can try to pair students who do not know each other prior to the course. But of course, sometimes you don't know this information or don't have complete control over it, and that's okay if that's the case. You can roll with that. All right.
Okay, so let's talk a little bit more about practice. We've emphasized it already a number of times. And the reason practice is so important is because we want students to learn the skills. We need them to learn exactly, how can you know when to do an open question if you don't know how to do an open question? So we want to teach students, and typically to learn these skills, it takes a lot of practice. And we need to have lots of different kinds of practice because you learn different things from different kinds of practice. So you can have written stimuli. We have them, a lot of them in the book. You can write down a response. You can watch TV and give a response of different kinds to people on TV. But most importantly, to practice with other people who are real at the time, talking about mild issues like we talked about, but issues that are important, because each client needs something different. So we need to modify it. And it's so important to have that small group practice, paired practice, large group practice many, many ways, so that you begin on each skill separately and then practicing integrating the skills. So when they're practicing, we explain that the helper, of course, is trying to be as helpful as possible, and that the helper needs to be a personal scientist, needs to look at how the client responds. If the client's responding well, you might keep going. If the client gets quiet or gets upset, you try something different. So you keep looking at what happens. What are the immediate effects of your intervention? And you then modify your interventions based on that. Now, the helpee, on one hand, yes, they're helping the helper, but on the other hand, it's really a crucial role because you're learning what it feels like to have these skills used on you. You might not like a restatement. You might get annoyed by a restatement, but you might like advice. And so you learn what works for you. When you're a helper, you learn that what works for you doesn't necessarily work for somebody else, but it's very important to feel the experience, the skills used on you. And the observer role is also important because you see, is that modeling? You see what other people are doing and you go, oh, I could do a reflection like that. And you can also be watching to give feedback to the helper so that they can learn more. Because as helpers, we're often not aware of how we come across. So we need other people to give us feedback. So the role of the observer is to give feedback, the role of the helpee is to give feedback, and the role of the instructor is to give feedback. And typically, of course, we all want some positive feedback because we need to know that we're doing something on the right track. So sometimes you have to search hard, but we need to give a little bit of positive feedback. But we also need some corrective feedback. We need to figure out what to do a little bit differently. Not too much because it's too hard to change if it's overwhelming, but a little bit of positive, a little bit of corrective. It's also important if you're having people working in pairs, which you're going to be doing, as an instructor to walk around and make sure that the students are on task, that they're doing things, and that some students not getting too overwhelmed by emotions. Because sometimes things can get out of hand. We need to be there and make sure things are going well. At the end of each lab, it's very important that we process what went on. Okay, they've been getting feedback all along, but we need to pull back and integrate. One of the really important things we found in psychotherapy and helping in general is the helper, the therapist being reflective, being self-aware. How do I come across? What's going on? Where are my own issues getting in the way? When am I most helpful? When am I least helpful? So at the end of each lab session, we want to go around as a group and ask each person, what are you doing well so far? And what do you need to keep working on? Usually one thing to keep working on, not everything, but at least one thing to keep working on.
Okay, so finally comes to a part of being an instructor is to do evaluation, to give a grade at the end of the semester. So it is really hard for this course because there are a lot of there are few right answers. As we mentioned, there are many ways of helping, there's many ways of intervening. So but we still need to give a grade, right? So we still rely on a lot of the traditional exams. For example, exams on theories, questions about definition of helping skills, or give an example of helping skills to a client scenario. How would you ask an open question, or how would you reflect a feeling when a client say this or that, right? So that's one kind of one part of the evaluation. But the second part is to really talk about rewarding the efforts and practice and reflection. And it really goes on to an example that all three of us have used is to transcribe an actual interaction between a helper and helpee. So depending on the level that you're teaching, undergraduate or graduate, it could be a 20-minute interaction, or it could be a full session interaction. But what is important is that we grade for the completion and the accuracy of the coding of helping skills rather than the quality of the interventions. Because if students feel that you're judging them or evaluating them for how good of a restatement that they're giving, then it is very hard for the student when they're doing the session itself, because they will be thinking about how well they're doing. So we are encouraging instructors to just grade on the accuracy, whether they are able to code the helping skills correctly, whether they are breaking a speaking turn into meaningful meaning units correctly, things like that. And then on the reflection piece, we ask students to develop what we call alternative interventions or alternative skills. So if you were to do the interaction again, what would you say at this particular speaking turn, right? So students can talk about an alternative skill that they would use, and then give a rationale, and then anticipate, reflect on how is this skill going to lead to a different response from the clients, and down the road, how is this response from the clients helpful to them ultimately in terms of their helping session or the goal of helping. Right. So I think this is an example of what we do in terms of evaluation.
Okay. We've tried to go through a lot quickly, but let me just kind of try to conclude where we're at. This is a great course to teach. I've loved teaching it over the years. I think Harold and Judy have loved teaching it. At the University of Maryland, it's always been the most popular course because it's a very different kind of course. Students get personally involved. They really feel like they get into the course. And I want to emphasize that the book almost feels like a living document, because we keep changing and growing and learning more about how to do helping skills. It's interesting as I think over the evolution of the 6 editions, we've really grown a lot. We're getting closer and closer to the clinical phenomena, I think, so that we're really coming to be aware that helping is hard, therapy is hard, and we can't just come up with easy answers, but we need to get more complicated, but do it in a way that students can begin to digest at an early level. It's very important in teaching this course to make it your own. Just as for the helper, they need to make it their own. They need to use skills that work for them. As an instructor, you need to make this course work for you. We've designed it the way it works for us, but it'll be different, and everybody's going to teach it in a different way, which is what I said earlier, that the trainers have a big impact. So we know you need to make this your own and figure out what works for you. And really, I want to come back to this point many, many times. This is not a cookbook. We can't say, use a reflection of feelings all the time. That's what I used to say in the first edition, because I always loved reflection of feelings. And as our research is beginning to show, they're not always that great, which is heartbreaking to me. But many skills work. If we're trying to get at feelings, you can use open questions for feelings. You can use disclosures of feelings. You can use many skills. It's a matter of when and how. And so what we're teaching people is not just to use how to do the skills, they need to learn to use the skills, and then they need to learn when and how to use them. The skills need to be taught in the context of self-awareness, cultural awareness, ethics, empathy, being responsive to clients' needs. There's so much that we need to do it in the context of. It's not just skills or that they're facilitative conditions, it's all of it put together. So we're teaching people how to think critically, going back to that. And it's important that we practice the skills until mastery, although I don't think anybody ever masters the skills. There's a reason we call it practice. People are always practicing, and it's always using the skills is always different with every client. So we need to reflect on when to use it or not. And then ultimately, we're so good at using the skills that they go into the background. You don't hear an experienced therapist talk about, well, then I did a reflection of feelings. It's more, that's part of who they are. They know when and how to reflect feelings. So I just want to come back to this as a great course. We love teaching it, and we hope that we've offered a few things that help you all. And we're really open to taking some questions now.
Thank you so much. And thank you to everyone for your wonderful comments and insights in the chat. So I will start with a few of the questions that we've received, excuse me. Question here. I am wondering about the approach or teaching professionalism. Have you addressed the ways professionalism can look in diverse communities? For example, dominant society expects how the helper dresses as a reflection of their professionalism.
Judy, you want to tackle that one?
Start us off. I think it's such a great question and really ties into what we've mentioned but haven't spent so much time on today, which is that these skills exist in a context, and it's critical to be teaching these skills within the cultural context and to be adapting to the cultural context of the two people in the room, both the helper and the client, right? And so, of course, this is, professionalism does look different in different cultures and different societies, different contexts. What does professionalism look like in a class when all of the students are, undergraduate students, for example, all sort of on the same level and on the same status professionally? So that's a great topic of conversation that I would even bring up with my students and ask them about and engage in conversation around that. Right, because it's not just, there's so many facets of that, not just how you dress, but how you keep the space around you, the types of things you say, the language you might use with your clients, all those sorts of things go into professionalism.
Mhm.
And I would also add expectation from the clients, depending on the culture that you come from. So some culture would expect a little more direction or directives from the counselor versus in a more where in places where the power distance is a bit lower, people will expect more collaboration and exploration. So it really depends on where you are coming from culturally and what helping looks like. Yeah. The script. Yeah.
Also, we talk about, in terms of dressing one step up from the clients.
Yeah.
So that helps sometimes to become more professional and to feel more professional, and to talk about differences between helping friends and family, where it's back and forth, where everybody's expected to give 50-50, versus as a professional, even if you're the same age, once you're in that role, you're looked upon differently. What does that mean? Now, how do you teach it? We don't have any research to show how we teach it, but we know it's important. And so we know that one of the big things people get out of a course like this is becoming professionals. There's a nice paper in the literature, I don't know, can't cite it offhand, but that's one of the things people say is you become a professional. So it's kind of a lovely thought.
Mhm.
Our next question is, sometimes students tend to quickly jump into problem solving rather than showing empathy, responding, or reflecting. based on your experience, how do you teach empathy skills? On one hand, we don't want them to feel frustrated, but on the other hand, these skills are like cooking. They require practice and precision. First, I want to say that's a lovely question. That was well written. Thank you to the person who asked it, but I'll turn it over to you all.
Harold, you start.
Yeah, so I think it is very common for students to get into the role of giving advice, especially if they are coming from, thinking that helping in a friend-to-friend way in a family context where, siblings give a lot of advice to each other. I think one thing is to distinguish what, intellectually, what is helping. So there's a lot of discussion at the beginning. What is helping? How is helping in the professional context different from helping in other contexts? So to friends and family, that's number one. And secondly, I also sometimes use examples that could be, there are many different reasons why a person, say, procrastinate, right? So they could be perfectionistic, they could be anxious, they could be just for whatever reasons. There could be so many reasons, but when you keep the first thing that you go to is to give advice, you may not know the full picture of the problem. So giving them a sense of there are many reasons behind, or there are many motivations behind a certain thought and feeling or behavior, then students get to, step back a little bit and explore more before giving advice. I think that's one approach that we use.
Absolutely. I'll just jump in here that just to add to what Harold said, that we have to understand the problem in order to be able to try to work on the problem. And so that's why we're trying to get at exploration as a base and foundation, and then, sprinkling in action skills and insight skills as we go along, but really exploring the problem, the client's thoughts, feelings, reactions, experiences, relationships as deeply as possible, so that we can, really help them when it comes to action. Now, sometimes it is appropriate to start with action, right? Because the client is in crisis, for example, or maybe they need to do it would be helpful for this particular client to become more regulated or get some action in before they're even able to look deeper and dive deeper. So it depends on the client. But one more thing I just want to add is that I think for students, I found that some of this sort of jumping to action is related to their own anxiety about wanting to help. They come into this profession because they want to show up for people, they want to make a difference, they want to help people. And so that tendency to want to have that quick fix and resolution is really critical to try to understand and explore from the point of view of the helper. Why are they rushing into the action?
Mm-hmm. One thing that I just thought about is how we can also ask the clients what it was like to hear the advice. And they can tell you, okay, yes, but I have tried this before, or I feel like I can't keep talking about my problem because, you have already given me an answer, and that is antithetical to what we are trying to do in exploration. So I think asking the clients to give feedback based on what they hear is also a way to learn empathy, because when the client don't get to a chance to speak their mind, or we don't hear what the client is thinking, then the counselor or the helper simply cannot know. So yeah, encouraging client to be honest and open about what they feel, how they feel.
And I would just add to that a little bit. I think that's absolutely right. Ask the client. And it's up to the helper to be the personal scientist again. Observe how the client responds.
Mm-hmm.
If what's your goal in giving the advice? Is your goal to give them ideas? Did they get new ideas? Is your goal to give them reassurance? Did they get that? So to observe what happened when you did it. And what generally, would want clients to get more active and say, well, I could do that, but I could do this. And if that's not happening, then you need to try something else.
Great, wonderful feedback. Thank you. Next question here. I've taught this class 3 times now and have noticed that for most students there is anxiety. but there's also been a small segment of students who become angry and direct that towards me. And my guess is that the anger is related to the anxiety and the stress of applying the skills live, and that there is no cookbook approach. Has this happened to any of you? And if so, how have you handled it?
Judy, you want to go first?
Yeah, I'm trying to think if I've experienced direct anger toward me. I think what's coming to mind is maybe some instances related to like the attendance policy in the course and maybe grading sorts of issues. Because this is a practice-based course, students need to actually show up and be present in the course. And so it's a very clear policy that we set from the beginning, and then sometimes students don't follow that policy, and there needs to be some, conversation around that and potentially some consequences. But I can't recall any particular anger directed toward me related to the use of the skills. Certainly frustration, certainly anxiety. So I'm curious, Clara or Harold, if you've experienced that and how you've handled it.
Yeah, I remember there was one semester that really stood out to me when a student, after disclosing, felt really vulnerable, and that vulnerability become, and manifest as anger, and feel like, okay, why are you putting me through this? So I think there's a lot of there's a great need to, slowly prepare your class in terms of disclosing, because people can really respond very differently depending on their history. So that came to mind when I think about, potential anger, and if students don't feel like they respected or empowered to say no to disclosing, and things like that. It gets tricky. Yeah, especially when they are dealing with other helpers who are at the same level, if they're their fellow classmates. So yeah, really, like, I really echo what Clara said about being able to walk around and see what is happening in the room and try to catch that early, will probably be useful. Yeah. Clara.
It just seems like there's obviously something going on. There's all the different classes, and there's always group dynamics that happen. And I think this course elicits a lot more of that than other courses where there's just you sit and listen. A couple things I could think of is to spend a lot of time at that end of the lab talking about what's going on, how are you feeling, what's going on in our group. Lots of times when you get to the chapter on immediacy, that's a really good time to talk about group dynamics and how each group is different. The other thing I would kind of begin to wonder is, at least at our university, you can have consultants come in and watch what's going on. So I might actually go to the teaching center and ask for somebody to come in and see if there's something I'm doing as an instructor that is getting in the way.
And sort of a related question is how do we tackle when a student shares a lot more than they are supposed to, and it gets really personal? And how can I address this sharing and feelings while practicing therapy in classroom sessions?
Mhm.
Harold, I think you're first.
Yeah, so I think it is really important to sense where the conversation is going. I think there's there's a need for clinical intuition too as an instructor, because you probably, should pay attention to your gut feeling. If it is something that you're feeling really queasy, you feel that this is not going down a good road, maybe it is good to stop in the moment. We don't have to be, allowing them to say everything on their mind. We say this is a lot, and maybe this is a good time to stop, and we can talk more about this after class. Let's discuss this after class and see, where this conversation can how I can be, helpful to you. But yeah, that's something that I thought about.
Yeah, I'll add, it's always really helpful, even if the student is not necessarily going into something that's incredibly personal, to, periodically pause the group. If you're doing a group session with about, 10 or 12 people in the room, if you're doing a session where you're integrating the skills or even just practicing one particular skill, to pause the group and to check in about what's happening. This is a great opportunity to talk about conceptualization, right? Because oftentimes in the beginning stages, students will say, I don't know where to go with this, or I don't know what kinds of questions would be important to ask here. And that's a time where you can generate, a list of things that would be helpful to talk about or explore more. So that's always something that you can sort of keep in your pocket and pull out, even if, or especially if things start to feel like they're going off the rails, just sort of pause the group, check in, do some conceptualization, and kind of regroup.
Yeah, I think it's really important, when things get over, as I mentioned in the slide I did about clients being overwhelmed by emotions. And I think it's really important for us to step in at that point, making sure that it's not us that can't handle the emotions. That's a big factor to think of first, but then to pause it and say, it feels like it's getting a little too heavy here. Remember, we talked about in class that list of things that are good to talk about, not good to talk about. And I'm just thinking that maybe this is a little too heavy right now for the helper. And we want to focus, because our focus is always on helping the helper. Okay, we recognize that the client can get help, but that's not our purpose in our training. Our purpose is to help the helper get feedback. And if things are too heavy, the helper is going to get overwhelmed. And so, I think that can kind of take the onus off it a little bit. Not that this is a bad thing, but that this isn't just a place for it. And there are occasions when you as an instructor may have to walk the student over to the counseling center because they may be at a crisis point. I've had to do that. You learn things quickly, and sometimes students are in crisis. So they need help. So it's not just a matter of getting them to be quiet. It's a matter of figuring out how to get them help. But remember, again, our goal in the class is to help the helper.
Right. And our final question, Clara, you mentioned at the beginning of the presentation that there is a lot of research that has been done on this approach. And there is a question asking if you can say a little bit about the type of research you've done with this model to determine its efficacy.
Yeah, great question.
And Clara has to go on this one.
Yeah.
So this book here, we have a chapter in here. Sarah Knox and I have a chapter on the effectiveness of training and supervision. It's the Bergen and Garfield Handbook of Psychotherapy and Behavior Change, 2021, and we reviewed the literature on training. We were fortunate enough at the University of Maryland to have a number of classes. Usually there would be 3 to 6 classes in helping skills a semester. So this was an ideal opportunity for us to do research. And so most of our research was on undergraduates, because when you have graduate students, you maybe have 3 to 5 in a cohort or 10. It's really hard to do a lot of research there. So we would, in fact, Harold, you could talk about the insight study, but we've done a lot of studies looking at the effectiveness of the helping skills and the effectiveness of the components, looking at classes. It's tricky because it's naturalistic. And so you can't, you have to be really cognizant of not interfering with the pedagogical nature of teaching. But if you give students consent, you give them credit, you get their cooperation at the beginning, they're usually quite happy to participate in research. So I would just refer you to that chapter for a review of our literature. And Harold, maybe you could say a little bit about the insight study.
Yeah, I think what we did was to ask students to rate their self-efficacy in using insight skills at different stages of in different times in the semester, and it corresponds to the different components, so lecture or before lecture or after a certain type of practice. And we found that students really had a big jump in their self-efficacy after practice, and so that's why we say that practice is really important. And we also got feedback from students in terms of their preference or what they found useful in the training. So it also points to practice. So both objectively as well as the subjective experience of how practice helped them with learning helping skills.
I would say that, coming back to the importance of research, we have done a number of studies on helping skills training as well as specific studies on the skills used in helping skills training. And the research has entered into our helping skills model because, like I mentioned briefly, that some of the research shows that reflections of feelings aren't that helpful on average. And so we really have to modify our training to incorporate that kind of research. What do we do with that? Because I always believed they were the most helpful skill. So somehow we have to say, well, if they're not that helpful, what is it that's not helpful? And how can we change our training to incorporate more of what is helpful? And so I think we've really been able to use, the research has really been important, not only to show that the model is effective, but also to help us change the model to make it more effective.
Great. Thank you so much. We are coming to the end of our time together. I want to thank everyone for attending and for asking such wonderful questions. And thank you to our Helping Skills author team. We appreciate you so much and your expertise on this topic. And thank you for sharing it with all of us. I have shared a few things in the chat for those that are interested in getting a digital exam copy of the upcoming new edition of Helping Skills. There is a link that only works in the US and Canada. So I have also linked internationally how you can get exam copies. There is also an upcoming webinar on experiential education for counseling and therapy that may be helpful or interesting to all of you here. So I've also linked that in the chat. And thank you again to everyone for coming. We really appreciate it. Please look out for your attendance certificates and a follow-up email with a recording, chat transcript, slides, all of that stuff coming from us in the next week or so. We appreciate all of you and we hope to see you again soon. Have a great day.
Thank you.
Thank you.
Goodbye all.